Chest pain is any type of pain felt from your jaw down to the bottom of your ribs. This pain can have many different causes, some harmless and some life-threatening, such as a heart attack. That is why we never ignore a patient with chest pain, even if it is not significant. And that is why it is important for you to know the signs of an emergency. Hello and welcome back to Dr. Solar channel. This is Dr. Fatima, and today we are going to talk about the causes of chest pain and its treatments. So if you're interested, please stay tuned. Generally, chest pain can be caused by a lot of different factors. It can be your heart, your lungs, your muscles, your digestive system, or even an anxiety. Firstly, let's talk about the most important cause of chest pain. Your heart. Most of us know chest pain as a sign of a heart attack, but the fact is that there are other heart problems that can cause chest pain, such as arrhythmias, aortic dissection, or the inflammation of the sac around your heart, which is called pericarditis. But what is important is that you know a couple of signs and symptoms that tells you, okay, it is your heart and there's no joke and you should call an ambulance. So when your chest pain comes from your heart, you feel pressure, tightness, and fullness in your chest. There is most of the time a crushing or searing pain that radiates to your neck, your jaw, your shoulders, and your arms. If your pain is related to your heart, you might have shortness of breath, cold sweats, dizziness or weakness, and nausea and vomiting with it. Okay, now there's a point that I want to make about diabetic patients, because we all know that there are more and more people getting diabetes every day, and diabetes kind of affect your nerves and make your heart attack painless or silent. And that's why a lot of diabetic patients seek help really late, and they kind of lose their golden time to be survived. So if you're a diabetic patient and you are experiencing a mild version of all these signs, or you generally feel unwell, please seek help. Women, on the other hand, are more likely than men to have some heart attack symptoms that are not related to chest pain. They might have nausea, fatigue, or gastrointestinal upset as their main symptoms rather than chest pain. In 2013, there was this article that evaluated the effect of how much the people knew about a heart attack and their risk of having a heart attack in the future. And the results were really interesting. They showed that the people who knew more about heart attack had less risk factor for having a heart attack in the future. So it's important to know the signs of a heart attack, and it's also important to know some of the risk factors for having a heart attack. So if you have some of these risk factors, it means that you are more likely to have a heart attack than the people who don't have any of these risk factors. These risk factors include being 40-year-old or older, using nicotine, being obese, having diabetes or high blood pressure, and having high cholesterol levels, and having a strong family history of heart disease. So by family history, we mean that you have a first-degree male relative who had a heart attack under the age of 55, or a female relative under the age of 65. So in case somebody has all these symptoms of a heart attack and you called an ambulance, while waiting for an ambulance, you should just try to keep them calm and not moving a lot. Another cause of chest pain is called angina, which is a situation similar to a heart attack but less severe form of it. So basically, angina happens when there is a reduced blood flow to your heart muscle, meaning that your heart muscle doesn't get enough oxygen. But if a part of your heart muscle doesn't get any blood or oxygen, meaning that the artery that nourishes that part is totally blocked, then there would be a heart attack. Angina has two types, which are stable and unstable angina. So if you have a stable angina, you might have a compressive chest pain, sweating, and a little bit of shortness of breath when you do some activity, but you get better by resting and taking some medications. But if you have an unstable angina, you don't get better with rest, and it's actually a sign that you are at high risk of having a heart attack. The third factor that can cause chest pain is heartburn or acid reflux. So if you have acid reflux, you might have a burning, painful chest pain that can come up to your throat or maybe felt on your stomach. Heartburn usually occurs after eating or while lying down or bending over. It can be accompanied by a sour taste in your mouth, and it usually gets better by taking antacids. But if you are having a persistent chest pain and you're not sure if it is a heartburn or a heart attack, just call an emergency medical help. They can help you and assure you. Another reason for chest pain is an attack of anxiety. This can happen for you if you have an anxiety disorder or if you suddenly feel anxious or afraid. Some other symptoms of an anxiety attack is hearing your palpitations, nausea, trembling, sweating, or lightheadedness. While having an anxiety attack, you might feel out of control, but I am going to give you some tips to make it easier to have your control back. Some self-care strategies to help with anxiety attacks include regular aerobic exercise, getting adequate sleep, yoga, and eating a Mediterranean diet. Cognitive therapy and medication are also a central part of treatment of anxiety, which can help you decrease your symptoms. Another cause of chest pain can be lung problems. Lung and breathing problems can cause a sharp, sudden pain in your chest. Some of the lung problems can be really serious. So if you have a chest pain that worsens if you take a deep breath, if you have a chest pain that worsens if you cough, if you sweat and you have palpitation, it's better for you to see your doctor immediately. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And if you have a problem that you think I can help you with, please leave a comment below and I'll try to answer it as soon as possible. Bye!